Hello, everyone. My name is KBowd, and I'm a residential social worker based in a short-term children's home in the Southeastern Trust, where I have worked for 13 years. As a short-term home, our home is the first point of entry for young people entering the residential care system in the Southeastern Trust. I'm also employed by Action Mental Health, New Life Counselling, where I work as a systemic family therapist. So in my first slide, I'll explain that my experience when I first started working in residential childcare was that when a young person is admitted into care, there can be and usually are very strong narratives surrounding them. Narratives told by the family and by the professionals working with them. And those narratives can very quickly and easily be accepted and carried on within the residential environment. That these young people are beyond parental control and that they are the problem needing to be fixed. This can lead to a lot of blame and shame on a young person at the time of admission and instantly impacts the beginning of their time in care. What I also noticed was that there seemed to be a separation between the child and family when a young person was admitted into care. That the residential team's main focus was working with the individual young person in the context of the residential environment and managing behaviours within it. We began to notice as a team that when a young person returned home to spend time with family, there continued to be breakdowns and arguments between family members. I wondered about the young person progressing and the family remaining static, unable to contribute to or understand the new techniques that the young person had learned. I felt I needed to educate myself further in regards to understanding these processes, and so I began my journey on the systemic course at Queen's 8 years ago. Next slide, please, Suzanne. One of the very first questions put to us when we began our course was, what do you understand by the term family? A term that many of us struggle to define. Systems theory describes family as a complex social system in which members interact to influence each other's behaviour. A systems perspective then would suggest that the behaviours of a young person are a symptom of a larger problem within the wider system in which they live. And it may be that the whole system requires support, as well as the individual young person. As a residential social worker, this learning in itself highlighted a new and different way of talking with a child at the time of their admission to care. These children do not come to us as isolated individuals, but as members of complex social systems. And we as professionals must strive to understand this whole system if we can. Such a responsibility can be placed on a child entering care to hold and tell their family story. My systemic training taught me that I must lighten and share this responsibility by engaging with and including other family members from the point of admission in these conversations. In my next slide, I explain a couple of the systemic techniques that I used in an attempt to introduce difference into family stories and begin safe conversations about what has been happening for these families that led to an admission to care. Techniques such as asking about exceptions. When is it not like this? And using circular questions to widen conversations. If Jane was to tell me something positive about you as a mum, what might that be? These techniques can support family members to think differently about their relationships, rather than focus on the strong negative feelings that can surround an admission to care. My next slide, I talk about managing difficult behaviours within the residential environment. And we experience a lot of pain-based behaviours from young people. These can take the form of verbal and physical abuse, causing damage to property, misusing alcohol or substances, and self-harming, to name a few. Staff are trained in therapeutic crisis intervention, or TCI, which asks staff to consider 4 questions when supporting a young person in crisis. How am I feeling? What does the young person feel, need, or want? How is the environment impacting this young person? And how can I best respond? My systemic training further added to this and introduced techniques of how to respond. One of those techniques being reframing. This technique asks us to really consider what may be happening for this young person and to rename it. An example of this was when a young person in the home's time with her mum had been cancelled due to issues with transport. The behaviour we observed was screaming, smashing items within the home and kicking doors. This behaviour could easily have been described as aggression, anger, or kicking off. But I took a moment to really try and understand what she might be feeling and then voiced this. I know that you are really hurting right now. This reframe of the behaviours immediately changed the meaning for this young person, and she began to cry. An opportunity was created for us to sit and talk about why she had been so hurt by the change of circumstances, bringing new information that I had not been aware of to light. As a systemic practitioner, I then opened up a conversation with mum via telephone, wondering what would happen within their own home if this situation was to occur. Instead of shouting, as mum stated she usually would, I wondered, could mum try something different so that she and her daughter could talk about what was upsetting or troubling them in those moments. I also created new and different narratives with the team in handover, in written reports, and when updating other professionals. This is an example of how introducing difference can have an impact when managing crisis. However, as residential social workers, we are in the privileged position to spend so much time with young people in the context of the home that we can find therapeutic benefit in so many of our relationships and conversations. As I progressed through my training and learned the importance of slowing conversation down and punctuating to explore meaning, I actually found myself noticing many missed opportunities for therapeutic conversation within the home. So in my next slide, I explain that as residential staff, we of course want to help young people, and systemic teaching within the course challenged me to think about how I help people and why. I ask you to take a short moment and consider your response to a young person stating, "My mummy doesn't love me." Many a well-meaning and caring professional would instantly respond, "Of course she does," with the intention of reassuring and comforting this young person. However, by trying to fix this situation, what we may have actually done is negated what the young person has said to us and lost an opportunity for therapeutic conversation and understanding to develop. Systemic practice again teaches us to identify opportunities offered to us by individuals and families to ask about and truly understand what has been said. And this example could have been seen as the young person inviting us to ask, why? In the fast-paced daily environment of a residential home, I have learned to slow the pace and create the space for these often missed opportunities. A more therapeutic and systemic response to this statement could then have been, what has your mummy said or done to make you think that? Or, would anyone else in your family tell me that? Or would they tell me something different? Again, creating an opportunity for learning and understanding and for therapeutic relationships to develop. So my next slide, I move into my master's level training within the course. And what daunted me most as a practitioner was the clinical placements. Not only would I be working with families, my practice would be observed and then reflected upon by my supervisor and fellow students. This was, I would quickly learn, not only my favourite part of the course, but by far the biggest learning opportunity for me, both as a trainee family therapist and also a residential social worker. The experience of my practice being observed and then commented upon in a safe and curious way was so empowering and challenged me to further think about how I help people, what I notice and pay attention to within conversations, and what I might be afraid to ask about and why. I thought again about the unique position we are in as residential social workers, in that we observe each other's practice on a daily basis, and wondered how I could introduce aspects of the reflecting team safely back to the residential home environment. I sought opportunities within handovers, team meetings, consultations, and daily conversations within the office to highlight noticings about practice and to ask about the thinking behind practice styles. So often in residential, we move so quickly between interactions that staff may not pay attention to the things they have done well or what did not go so well. And I now recognise the strong value in giving this the time and attention it should be afforded. The residential environment is also a complex social system in which members interact to influence each other's behaviour. And so it is important that practitioners are given the space to reflect upon their interactions within it, how they are influenced and how they influence each other. Reflective practice or group clinical supervision could be a safe space to talk about and challenge different aspects of practice for teams in this way. So finally, in my next slide, I explained that an aspect of the course was to complete family therapy hours within my own work setting. My manager, Adrian Graham, supported me to create a separate space for therapeutic work with families outside and separate from the care environment. Assessments within my clinical placement taught me that family therapy may not be suited to all families, and that does have the potential to cause harm if rushed. I kept this in mind when working with certain families, and in some cases, my work involved working with a young person, parent, or family members separately until it was thought safe to bring them together in conversation. This opportunity was invaluable, both for the residential team, as I was able to bring back so much more information from the family members and my witnessing of the families' interactions, but also for the families who voiced that they felt listened to, that they had stronger relationships with residential staff, and that they were not as concerned coming up to big meetings as they felt understood and supported in their experiences. So in my final slide, as my training came to an end, what I had hoped to end the course was in the position and as a systemic family therapist and to look for a position practicing as such. But what I did not expect was the greater understanding and appreciation that developed for the position of a residential social worker and the therapeutic opportunities that arise within everyday practice within a children's home, for the young people, for the families we work with, and for the staff members. Thank you very much, everyone, for listening to my presentation today, and I am going to pass you over now to Jennifer McKinney.